Dr. Ruff at ASAPS 2019, and you are actually going to be adding the M-Sculpt into your practice very soon. I know some people out there might not be very familiar with the M-Sculpt technology or a lot of the technology with BTL, since you guys use a lot of the same kind of aspects in a lot of the devices. Do you want to kind of go into what M-Sculpt is and what the kind of the treatment involves?
Yeah, so first of all, we're excited to partner with BTL. They're a great company. I think they've got a great track record. This is a unique device. There's really nothing that competes with it in this sphere. It uses a unique energy EMP. That just sounds cool.
Absolutely.
It engages muscles in a way that nothing else does. It not only helps increase muscle volume, but right now it targets the core, and I think that is it's something that we see diminishes with aging. But for those those gym rats, it really helps even increase or optimize what can be done even in the gym.
No, absolutely. And as someone, I'm one of those guys who's in the gym constantly as well, and I was able to try M-Sculpt actually a few days ago, and I still can feel it in my abs. I also know that as the abs deteriorate, a lot of people start having some lower back pain as well, and I've heard that the M-Sculpt can also help in that area as well.
No, it's all about stabilizing. That's why all these businesses that are like Solid Core and Core Power Yoga and all these. Everything we have learned is all about stabilizing that core. Even as a surgeon, holy cow! We are terrible with posture, and we push out on our abdomen. We don't engage that and hold our postures well. So as we get older, we all have back pain. We get postural issues. So I see this not just as a muscle building opportunity, because they have other applicators that will help with that. I see it really, there's a wellness aspect to it I think is unique.
No, absolutely. So just in your practice, because you're obviously bringing it into a plastic surgery area, how do you see it kind of cohabitating with your current patient base and what you kind of have going on?
So it's nice. We'll be the first plastic surgery practice within the in DC to have this. So that's exciting. Not only do we do a lot of body contouring, so I think it dovetails nicely with the Vaser and the Renuvion and the things that we do surgically, where we want to improve or even optimize those aesthetic or attractive contours from a muscle standpoint. But we also have a huge non-surgical component where this dovetails nicely. It also draws in a different patient population. Patients that maybe wouldn't have thought of, oh, can I do something in a plastic surgery practice that because I already look okay, but at the end of the day, we always want to look in the mirror and feel as good as we, project as good as we want to feel inside. So.
Right, no, absolutely. Do you, obviously the M-Sculpt is a body contouring and you guys already do a lot. Do you see it somehow interfering with your current business, or do you see it as kind of like building off of it and helping patients increase their results or their recovery time even quicker?
Absolutely. There's always a recovery, and a lot of times during that recovery, patients can't work out, and clearly that's something that people worry about. I think this will help alleviate some of that, because we can dovetail this within that recovery so patients don't lose some of their muscle mass, and then we can continue to maintain or even build upon that afterwards. So yes, I think it dovetails nicely with what we do surgically, but is also a complement or an adjunct or a standalone procedure for those who are looking for something a little bit different.
Absolutely. And so this is a little bit of a question that I don't know if you're going to know how to answer, but so I know you haven't had a ton of time to kind of experience it yourself, like full on. So what do you think is the first body part you want to go for? Like, do you want that bubble butt kind of going on, or are you maybe going to try the arm applicators?
Me personally?
Yeah, absolutely.
No, you know what? I've been in practice. I've been doing surgery for about 25 years now, and it's my back. And I was a big competitive tennis player, and I've lost some of that core stability. So no, for me, it's about my abs at this point. And not about trying to get a six-pack specifically, but really about improving posture, core, all of those things. So.
Oh yeah, absolutely. I think most Americans or most people around the world really don't have that kind of focus on our core, especially being in front of computers and stuff like that. We're always hunched over or something, and it's just our abs deteriorate just so quick, and we don't even realize.
Yeah, well, I think the whole untucked shirt phenomenon is to hide that little paunch, that belly, and if we have a very effective solution to that, we can probably be more confident just in how we present ourselves.
No, absolutely. And I think Yeah, and M Sculpt is going to be fantastic. I mean, also to be able to get, what is it, 20,000 crunches in only 30 minutes?
Yeah, it's pretty impressive.
So when it came to the M Sculpt and you were going to add it to your practice, out of all the kind of aspects or statistics that you kind of saw, what really drove you and what really caught your eye when it came to the M Sculpt technology?
So in talking to colleagues who now had it for a number of months to even a little over a year, what was really interesting is nearly half of their patients were new to practice. And I think that's interesting. There are very few things that bring that many or that percentage of new patients into the practice. And that's what we want to develop long-term relationships with these patients. And not only was it new patients, but these are patients that have stuck with them. So I think that's compelling.
What about it do you think really like brings in that new patient? Is it like just the results that is it? Is it the fact that it's just using this cool new technology? I mean, BTL has tons of videos online that show just the contractions and just how amazing it kind of works on the muscles. Like, what kind of aspect do you think it really is like bringing all these new patients in?
Well, it is cool new technology. I mean, once you say it's EMP, I was like, that's kind of cool. The newness or the effectiveness of it is also, I think, the most important piece to all of it. So yeah, anything that's effective, it's going to continue to engage patients, and we're looking to, like I said, we're looking to develop long-term relationships with our patients, and if this is something that seems to do that and is also highly effective, what more can you ask for?
Right, and so hopefully we see you at another convention soon, and we can get a follow-up and see how it's affected your practice.
Yeah, I'm excited.
Once you get it in there. But thanks for stopping by, and thanks for doing this. It was great having you on, and
awesome.
We'll see you guys next time.